No, the tingling you're getting in your hand and your arm is not normal. Welcome to Muscle Monday. Today we're going to talk about the scalene muscles. These are deep neck muscles. There's 3 of them. There's the anterior, which is the front, middle, and then there's the posterior, which is the back. So those are the 3: anterior, middle, posterior. And they originate or begin on the side of your cervical vertebra. Depending on which one of the 3 muscles we're talking about, it can be any of the bottom 6 vertebrae. And then they come down and they actually insert onto the first and second rib. So those live right underneath your collarbone right here. Functionally, these muscles actually do a few different things. If they fire at the same time together, they're a neck flexor, helping you look down. If they fire just one side at a time, they'll help with a little bit of lateral flexion and rotation to the same side, called ipsilateral. Same side as the muscle, so if you're firing your right ones, you'll lean and rotate to the right. They also are a muscle that aids in inspiration, especially if it's deep breathing. So if you take a deep breath in, they're muscles that help elevate that first and second ribs so that your lungs can fill all the way. Lastly, they function as posture muscles, so they help just with the head and neck posture as well. This can present a few different ways clinically. The first one is it really can play a role just in neck pain, especially if you notice like, man, every time I look to the right or I tilt off to the right, I'm getting a lot of pain on the side of my neck on the right side. These are probably a muscle that's involved with that, so that's something that we would definitely check out. Another big clinical indication that these have is actually for something called thoracic outlet syndrome. That is when you get pain or numbness or tingling down your arm into your hands. Again, there's a variety of things that can cause that, but the scalenes can be a culprit. So they have, between the anterior and the middle scalene, passes your brachial plexus, which is all the nerves that come down and innervate your arm. If those muscles get too tight and spasmed, they can lock down and cause some compression on some of those nerve roots, causing that pain down the neck and arms. That's gonna do it for the scalenes for this week. Join us on Thursday and we'll talk about what we can do to treat it and a good stretch for at home to try to help relieve some of that numbness and tingling there.